the team that had been behind to ensure that all the data is being collected at the right time, the planning team who spend all their time and efforts in ensuring that every data that is brought forward is being inputted. And also those who are at the editorial to ensure that all the figures and facts that are being given are really being validated. I now wish to welcome you within the premises of the PHEOC, and we want to use this golden opportunity to invite Mr. Mamadou Njai, who is the Director of Health Promotion for the Ministry of Health, who also serves as the mouthpiece to actually disseminate the information, the most recent information that is being collected. And I hope this coordination and collaboration that had been happening in between us would continue. Every day, 12 o'clock, avail yourself within the premises and we'll give you the most recent update. Mr. Njai, I therefore call upon you to give the information. Thank you.
Thank you very much, Chairman. Chairman IEC.
Off the record.
Oh, don't worry, it's okay. Okay. Okay.
It's okay.
Good afternoon, colleagues from the media. Good afternoon, my able chairman and the entire team of the Public Health Emergency Operations Center, or we call it the Command Center. Good afternoon, colleagues from the Ministry of Health. I want to welcome all of you to our regular briefing with the media to update you on the recent information on COVID-19. This update also includes the two cases we have. One, we all know about the positive case and the recent one that has also been reported yesterday. And also we'll tell you what we are doing also as a sector in collaboration with our partners and also under the leadership of the Public Health Emergency Operations Center. Our command chairperson is here with me and his team, what they've also been doing and what we expect them to do. First, I will give you an highlights, and then today, the 23rd of March, I'll give you the highlights. And the highlights reads, this meeting today, or this briefing today, is the 4th National Situation Report since the confirmation of the first case of the novel coronavirus COVID-19 in the Gambia on the 17th of March 2020. The first COVID-19 related death was also registered. You heard about it yesterday. The disease is the new confirmed case who had no epidemiological link to the index case. Cumulatively, the Gambia now records 2 confirmed cases. A total of 20 laboratory tests were conducted, and a total of 131 persons have been screened and placed under mandatory quarantine. A total of 310 people have been completed follow-ups and have since reintegrated into society, and they also resume normal duties. The global situation. Since 31st December 2019 and as of 21st March 2020, a total of 271,364 cases of COVID-19 in accordance with the applied case definition in the affected countries have been reported from 184 countries, areas, or territories. Of these, 11,252 deaths were registered, a crude case fatality rate of 4.1%. Gambia's only immediate neighbor reported 47 cases, that's Senegal. Other countries in the sub-region reported cases that reported cases are Ghana, Burkina Faso, Benin, Liberia, Guinea, Nigeria, and Ivory Coast. The first set of cases in affected African countries were imported. However, local transmission is now in the increase, which is really a cause for concern for all of us. The epidemiological description of the index case. You heard about the 28-year-old lady. We will give you an update on that. And it's a 28-year-old lady, a female for that matter, a Gambian, traveled to London, departed from London 14th of March 2020, arrived 15th March 2020 at 01:49 a.m. with flight number 579 and also flight name Royal Air Maroc. Number of people on board 58, including the crew, and she drove herself home. She lives alone, and she developed fever on 16th of March 2020, got tested at MRC Gambia on the 16th of March 2020, and laboratory results received on the 17th of March 2020, and she's currently being managed at MRC Gambia and is clinically and mentally stable. The second case, a 70-year-old male Bangladeshi national arrived in the Gambia by Sky Airline with 3 other people on the 14th of March 2020. Departed Bangladesh on the 4th of March and passed through Thailand on the 5th of March, Ethiopia on the 6th of March, Malawi, and then on the 7th to 10th of March, where they attended a religious conference. Went back to Ethiopia on the 10th of March, Mali on the 11th of March, and arrived in Senegal on the 11th of March and spent 3 days at the airport in Senegal on transit before leaving for the Gambia on the 14th of March 2020. They were picked up from the airport by 2 vehicles, was resident at Bundung Markas, a closely religious community since arrival in the country. He first reported to the OPD of Bundung and Child Maternal Hospital with mild symptoms on the 19th of March. He reported back to Bundung Maternal and Child Health Hospital the following day, the 20th of March, with severe pneumonia-like symptoms. The disease was a non-diabetic. Patient was referred to EFSTH, brought in dead on the 20th of March. Sample was collected at the EFSTH mortuary and transported to MRC Gambia laboratories on the 21st of March, and the results were positive, and the results came on the 22nd of March 2020. That was yesterday. Summary of public health response and outputs. I'm also happy to give you an update on that. As of the figures we gave you the last time, that was on Saturday, we had about the people who have been quarantined, we had 38 at that time, and now the figure cumulative with regards to the numbers that were added, we now have 131 cumulative. People who have also completed follow-up now is 310, and the suspected cases cumulative 13, contacts traced 25, and also cumulative now added to the other number, we now cumulative is 66. We also have confirmed cases, 1 added to the previous one, now we have cumulative 2. Deaths, we have 1, cumulative again 1. Total tests conducted 2, and cumulative to the added number will be 21. Now we have cumulative of 21. Positive test results added to the previous one we have, that is 1 has been added, meaning we have now 2, overall we have 2 positive tests. Negative tests, we have 1 added to the other, 1, now it's added to the 17, which means 18 people have now been tested cumulatively negative. Public health actions that have been initiated following confirmation. Incident manager and the team visited Markas immediately, and the other 3 Bangladeshi nationals and 9 other associates are currently on quarantine. 3 nurses, a doctor, an orderly from Bundung Maternal and Child Hospital who met the patient also among those on quarantine. Samples will be collected from all high-risk contacts. Plans are on the way to fumigate and lock down the entire Markas premises. Tracing of contacts and contacts of index case is also ongoing, like the previous case we had before. the contact tracing is still also ongoing. Screening, mandatory quarantine of all passengers arriving from hotspot countries, and testing of all suspects meeting the case definition is also ongoing. Continuous community sensitization is also ongoing. Daily press briefings we've started is also ongoing. Memos to facilitate rumor management and prevent the spread of false information has also been disseminated. So I'm sure all of you have access to that memo with regards to people disseminating false information and the laws that have been attached to that. Our next steps and recommendations. We will continue with tracing the contacts of the second case, including mortuary attendance, line listing, quarantine, and also testing of suspects that meet the case definition. Plans are on the way to quarantine all staff who have contact with the disease. Fumigation of Bundum Maternal Hospital, EFSTH, mortuary, and the ambulance that carried the corpse has also been done. SOP for sample reporting system to be developed and implemented with immediate effect. SOP for burial to be developed and disseminated. Logisticians responsible for receiving passengers at airport must reconcile flight manifesto with the actual number of passengers received. This should be facilitated by the airlines, that is Gambia Civil Aviation Authority and the airport immigration. Daily press briefings to inform the public of the current situation will also continue, and we will also assure you that that will also something that we have to maintain that. The training of drivers, mortuary attendants, personnel responsible for EOC, that's the center we are here, and also the quarantine center, security on COVID-19 will also be done. Fumigation and shutdown of Maracas, where the second case was identified, will also be done. Executive directives to suspend congregational prayers should be given and implemented, and as well as enforced. Shift of work, we've also put in place shift where people will work, those who are working at the 1025 hotline, handlers will also be done, and contact tracers, as well as rapid response team members and other members of this center. We also develop and implement the use of daily call logs, so that anybody who calls in, we will know who called and where you're calling from, and what purpose are you also calling us for. We also expand COVID-19 testing facility to the National Public Health Laboratory, BL3 laboratory, which is also, will also be strengthened, and we're going to use that. A rapid assessment tool developed for the upcoming nationwide assessment of isolation centers, health facilities, and POEs. This assessment tool will also be shared with other committees for their input to capture their needs and finalize and distribute and for use. Fumigation of the airport will also be done. Funds are yet to be released for COVID coordination and response, and as I said now, the funds will also be available as soon as possible. Now we are almost done with the paperwork. All transactions have been done. As soon as we leave this conference room with this meeting, I am sure they will get the signal as to what will happen, and I'm sure work will still continue, and we also acknowledge them and thank them for what they have been doing throughout the period, even without resources, but they've been working very hard. So we thank all of you for that. And that also brings me down to the end of our discussion, and then I just want to summarize this. We want to say a suspected case, just a case for definition, so that people understand what a suspected case is all about, and also what is also about community case definition. A suspected case means a person with history of travel from any affected country within 14 days, or close contact with a confirmed case of COVID-19 infected with 14 days, or exposure to healthcare facility in a country where hospital-associated COVID-19 infections have been reported with or without fever, cough, difficulty breathing. Community case definition means a person with hot skin, cough, not breathing well, and who has traveled outside the Gambia recently or has taken care of sick person in the Gambia. Probable case. A suspect case for whom testing for COVID-19 is inconclusive, or for whom testing was positive on a panorama virus assay. Confirmed case. A person with laboratory confirmation of COVID-19 infection with or without signs and symptoms. These are the terminology we want you to be using, and then we will also try to make sure that we make you this report we call it the situational report for 29th of March 2020, available to you for use by your various media houses. I thank you for your kind attention.
Thank you very much, Mr. Njai. I think you've done justice to the document by ensuring that no stone is left unturned. Now I would be inviting questions to come from the media, perhaps 2-3 questions, because the report had been very detailed. But perhaps before I open it up, just a reminder to the general public that we still continue to see people coming to us over here to lodge their complaints. The issue of people being in contact or being close contact is what we must try to avoid as much as possible. If you think there is a suspect that you were in contact with, use the 1025 and tell us who you are, where you are, we'll come for you. You need not to join public vehicle to come here to meet us. You are going to at least create more problems. So the reason why all these contacts are being created is to ensure that things are well coordinated. We must not allow to be that close to each other to promote the issue of the spread. So we expect the general public to adhere to this, and would also ensure that this very SITREP be translated into the local languages. As you all know, over 60% of the Gambian populace perhaps are illiterates. So we must not confine it within having it read, you publish, but let's also endeavor to at least localize it so that the last Jola person there at Sintet would be able to understand what we actually meant. So having said that, I now open the floor for possible questions or contributions. I thank you once again. Any question? Yes? Can you introduce yourself, the media house you're representing, and then you come up with your question?
I am Salif Wanja from Gambia Talents TV.
Good.
Mr. Njai, the question goes to you. You said the cause for concern is the local transmission as far as Africa is concerned at present. Now, I want to know exactly when was the time the health officers truly confirmed the victim who passed away, the COVID victim? Exactly when do they actually confirm he's positive? Is it before or that is prior to his death or it was after?
Yeah, let me take another question before I respond. Or yeah,
any other question?
No.
Yeah, we want to have. He's noting them down. Yeah. Can you introduce yourself, the media house you represent, and your question? Okay.
So in the statement yesterday, the minister said that about 17 people jumped the quarantine centers. So I did not hear anything about them. What is the, why did they leave, and what is the effort being made to get them back? The other question is also, I noticed that both the first and the second case that is being confirmed in the country is actually done when they themselves came to the health facility. So doesn't this signal a threat on the public that the ministry is not detecting cases by themselves?
Okay. Is there any third question before we would allow him to respond? Already I've had you. Would you mind to allow your colleague? Yes. Who are you and the media house you represent? Can you, the volume please?
One is a clarification about our question, because in the minister's statement, it is said that the disease came into the country on the 13th. But today, Mr. Njai is saying on the 14th. So I would like a clarification.
Clarification on that.
The other one would be, why the delay in shutting down the madrasa? Because this, I believe, is increasing the threat of the virus spread.
Thank you. Okay, now can we allow Mr. Njai to give response to the 3 or 4 questions that are 3 questions and a clarification
Okay.
that we've just had. Mr. Njai.
Thank you very much. I like that. When was the case confirmed? I think you heard that I said on the 21st it was confirmed, and the person died on the 20th. He died on the 20th, and then we have a correct sample despite the fact that the person died, but we want to be sure what was the cause of the death. So that was what was happened. I think if I'm right, the 21st was the time this, let me just confirm it properly. I think basically it was the, yeah, That's the 20th. He died on the 20th, and then sample was collected on the 21st, and confirmation was done yesterday. Huh?
Why the delay?
Oh, why the delay? In our opinion, there was no delay in this. What happened is, like, the patient already we know is a non-diabetic, and then he was just living by the hospital there. He went there, got his treatment, went back home to the Maracas. And then the next day he felt he's not very all right, and then he just went back to the, and then they had to refer. They've done what they are doing. They've done they're supposed to do. They did the procedures, and then make sure that at least he has to be referred to the next level for care. And then when they felt that there is a need for, because of this the coronavirus around, so perhaps and at that point when he was reporting, he didn't manifest any of the signs similar to the WHO case definition for coronavirus at that point in time. So when he died, and then there was thinking that there's a need for us to go further and test. And that was done. The test was done, and then it turned to be positive. That is what has happened. Okay? The next question, why people jump, they said about people jump quarantine, what is happening, why are we not detecting the case also why is MOH not detecting the cases? As I said, the virus duration is 14 days, that's the incubation period. And then in this 14 days, you can be with me. I may even have the virus. You may not know whether I have the virus or not. I said in one of my interviews that, in fact, this is helping us and also helping the scientists. So that the machines we have to look at the temperature while they're coming and to screen them, perhaps now they will now go back and now think of now, how can we improve on this machine so that they can be able to detect someone who have the virus even day one. These are things that can come. So as we are moving into a disease nature like this, it also it's a new disease. It's a new one. No scientist will tell you, I heard about this disease, or I know about it, and I know how the virus behave. Now now scientists have given themselves time and energy to search, do more work around this disease. And what I'm saying now is perhaps the system will improve, maybe after this, or maybe during the virus, because China, maybe they're doing a lot of work. So perhaps they've done other system that is helping them now to detect people early. So those things are now, communication will be among countries now to share the best practices. So why can we detect it? We've done what we are supposed to do. We did the temperature taking. We screened them at the airport, for example. We screened them at the borders. And at that point in time, if they don't manifest any of the signs and symptoms, automatically it will be difficult for you to make a judgment. What you can do, if you suspect, just refer to the next level, that is screening, to MRC for screening. But if you screen at that point, at points of entry, then you don't see any signs that is similar to the WHO case definition for coronavirus, automatically you cannot come to a conclusion. And that's what we made. That's what we are also very careful with that. And then I think people also should appreciate what we have as a ministry. We have a national public health laboratory that is also currently working on to upgrade the system, to build the capacity. Now capacity building, we have scientists among us in the ministry here. And they are helping us now to see that how best they can also strengthen capacity and build the capacity of the laboratory, both staff and equipment, to provide tradition that we have. And then very soon, you will hear, next perhaps before the end of, I will not give you a timeline, but very soon you also hear that the Ministry of Health under the National Public Health Laboratory will also be able to test for coronavirus, because we are also moving. We don't want to stay where we are. We started from somewhere. Imagine we didn't have this building before. Now we have this building. We didn't have the scientists before. Now we have the scientists who can do the job. So we are moving gradually, and I'm sure we'll be there. The delay in shutting down Maracas. As I said, we got this information about this particular case, I would say effective 20th of March. You cannot go to somebody's institution and shut it down without any evidence. Now we have the evidence to shut it down. We're going to shut it down. But before we shut it down, we're going to do fumigation. We've already got the information. All the details are clear with us now. Now we have the mandate to close. But at that point in time, before the 20th or before, around 17th, 18th, they heard about the statement. The statement was there that we should supposed to, all public gatherings must be suspended. But it is clearly stated. And they said all public gatherings in whatever form. And some people are saying they didn't see the things like churches and mosques in the statement. But all public gatherings in whatever form, including lumos and open markets, that is a clear statement. That's a clear statement. In whatever form, could be congregational prayers, either in churches or mosques. It's not happened. So people should have complied to this. So now we are going to ensure that it has to be enforced. It's in one of our action plan, and we're going to work with the ministry responsible for enforcement, and we make sure that the statement of His Excellency is a policy. It must be implemented. That all public gatherings, we are not saying you shut it down forever. We are saying we suspend it for 3 weeks. Give us time, 3 weeks, we do our work. Surveillance officers are here, they are doing their work. Contact tracing is doing their work. But if we are not closing down those public gatherings, you are making life difficult for the surveillance officers. You are making life difficult for the rapid response teams. You are making life difficult for laboratory scientists and so on. So we want to appeal to the general public. We are also aware that people are also conducting marriage ceremonies, or I would say wedding ceremonies, and naming ceremonies. All those sort of ceremonies are still ongoing. From now, we say all those things are banned for now. In fact, they are suspended for 3 weeks. Let's just be here for 3 weeks. After 3 weeks, then we come back. Then, as we move on, the command center and the chairman will keep on updating us as to where we are as a country.
Sure.
Do we need to move on and then review our statement? If yes, we go back and review and we make recommendations to government, and government will implement them. They will government rely on the scientists' recommendation. We cannot also jump to conclusion and make certain suggestions or recommendations. We have to look at our recommendation and look at its implication. Now we are all thinking of the local transmission. We could be trapped, because now if these people are now having the virus, for example, and they are living with people who are not even willing to come out, as my colleague said, people now need to come out and tell us, oh, I had contact with this so-and-so person, oh, I'm living around him, oh, we did a so-and-so thing together, or we prayed together. This is what we want to hear people. But at least we are happy that the rapid response team met here yesterday night, and they were also able to make a conclusion, and they were able to get certain people and put them on a quarantine. I think we have to thank them for that. Yeah. At that night, when they got the message, they didn't go home. I saw them here, I was here with them, but they were also doing certain meetings here, but they went back to conclude and to say that we are going to close it for now. And that's what is happening. And I think they must be commended for that. Thank you.
Thank you very much, Mr. Njai, for adequate.
Yeah, sorry. Perhaps maybe there was a miscommunication, but we are relying on the information we have here. Okay. Perhaps that information that went, in fact, that is not even in the minister's statement. Perhaps it must have been said by the slip of the tongue or whatever, yeah. But at least the date, what we got, as the team is following them, is on the 14th. They arrive here on the 14th, based on what we have and the tracing. So we are sorry for that. Sometimes when you make mistake, that's why our system, I think Minister of Health and partner, we have to thank ourselves. Because since we even open this Facebook page, people give us recommendations and suggestions, we accept them. And we are also open to suggestions and recommendations. So we are very sorry for that communication in trying to communicate different dates. But it's really on the 14th.
Thank you very much, Mr.
One more thing before you wrap it up. This gentleman, the old man you had made reference to, I think he had been here on the 13th, right?
No,
on the 14th.
14th.
Yes.
Perhaps this suggests he had played Friday at Maracas.
Perhaps.
Perhaps, yeah.
Yeah. Have you made an assessment as to how many people may have potentially come into contact with?
Friday was on the 20. Friday was on the 20. Yes. Yeah. I think he died on the 20th.
Yeah. Both the doctors and the people.
Yeah, we've done that. We've done that.
And people he may have.
That's what we are now.
Also have gone to their families.
That's what the team is now doing that now. Because if they get them on quarantine, they will get all those information from them.
Yeah, I think if you.
How many people are we talking about?
Well, maybe tomorrow when you come, you'll hear that.
Yeah, if you were following the update which he's just given, it has made it clear so far how many of those people we met. It says the incident manager and team visited Maracas immediately, and 3 Bangladeshi nationals and 9 other associates are currently in quarantine. You understand? That is in response to what you're saying. However, people still continue to call to say they think they had associated with him. Yeah. Even today, 2 came. In fact, Those two found some of you here. The media house, you saw them, one of them was tying the head. That's why I'm saying they need not to come. But there is also another risk involved. Once they know that they had been in close contact, let them use the 1025.
Exactly.
Wherever they are, we will go for them.
Exactly.
That's one thing. But another thing that it tells, I want to add, is there is no perfect system. There is no perfect system in the whole world. Okay? We are trying to improve on what is available on a daily basis. As we are giving you this information, equally we are learning how to move on. Okay? That's one thing. The other message I want to send is the culture of harboring people who are strangers you don't know should be a thing of the past. I know it's not something that our culture welcomes. Gambians, we are very open. We receive anybody. Let's take this example of the Bangladeshi who came. Yes, despite all the ports he had passed, they have applied the test, but none of them was able to capture, including the Gambia. That shows you how sometimes certain systems could be. But when he came, he was associating with people. And those people never revealed to the authorities of the stranger they have. And we are very fond of that, especially Jolas. I got a stranger. So everybody will rush to say, what sort of a stranger is the person? What ailment did he come with? We seldomly ask those things. And now we need to open up. Whoever we are dealing with, we need to know who is the person, where is he from, what is the travel history. These are very key. Remember we said yesterday, day before yesterday, that your first preventer is your own self. Every one of us should take full responsibility of your safety and security before anything comes. Okay? So these were things I wanted to elaborate, to add on to what he has just said. So, time...
Do you want to bring it to a close? I have a couple of questions.
I would love to, looking at the time and other pressing issues, but perhaps before you come, I'll make you the last, but ask him to be the second to last. Yes, come up.
Yeah, good afternoon, everyone.
Afternoon.
My name is Daud, a reporter at the Daily Newspaper. And my question is, yesterday I was listening to one of your health ministers, a communication officer at the Gambia Health. So his last name is Gandaban. I heard him saying at the St. of Umbrella that during the interview he said that the ministry have been prepared about any cases of COVID-19 since the disease was discovered in China. Like after that, the disease was discovered later in China. So before that, he said that the ministry have taken full measures that there will be no case, a single case of COVID-19 in the country. So after all the preparation they have made, according to what he said, Gambia is still receiving new cases of the COVID-19. So my doubt is, how is the ministry going to convince the public that they have been prepared for a long time while the country is still receiving cases? Does that mean a threat to the Gambia?
Okay, good. Okay. That's the first question. Can you have your multiple questions in one?
Yes, thank you so much. I mean, my first question is, I don't know whether you can actually answer this, but anywhere you look at in this world today, and you look at engagements by officials, usually it is the president who takes the front foot in engagements with respect to coronavirus, and at least the minister. I respect you guys are technical persons, more or less, not policymakers. Why isn't that our policymakers are not bringing themselves before the public through the press so that we can interrogate their policy-making decisions, their policy-making processes? Okay. That's one question. And the second thing is, when you look at all that the government has been saying, and even this press conference, when Mr. Njai is talking, there is a lot of maybe and a lot of perhaps. Are we really sure about the information that we are giving to the public when, in response to a lot of the questions that you are making? It's a lot of maybes and a lot of perhaps. I mean, these are probabilities, and in times like this, it is very important that when we are giving information to the public, we are certain, at least in most of the cases. If we are not, then we can talk about EVs, but there are a lot of EVs and a lot of times. And then you look at even the setting of this press conference. I'm sorry, I'm not meant to insult you, but you look at the desk is dusty, you look at the press people here. There is no health officer here to even tell us that we should stand at least 1 or 2 meters away from one another. At least to guide us on how our arrangements should be. I mean, these are all, it's, to me, I'm going to draw a conclusion, and you can guide me, that we are not so organized as a government in particular, and as, you know, people that are, you know, at the level of the youth. That's my question.
Okay, thank you. No, I would, okay, you start.
Yeah, let me start by responding. You have the notice somewhere?
No.
Okay, the ones I could remember.
Okay.
Now, on the issue of policy, I quite appreciate that bit that you've talked about. If you talk about the UKs, you talk about the Americas, you two Pence and Trump all the time at the fore to talk about issues. Yeah, but remember, there is also what we call delegation of responsibility that could be done. All that Modou Njie is saying, or I am saying, it's not Serigne Modou per se saying it, or Modou Njie per se saying it. We have been delegated to say it. It is on behalf of government that we are saying it. It's no harm that they do it, but it's no harm also for them to delegate that responsibility to us, to me. I mean, I know.
It's okay, now you've asked a question. Now you've asked a question now. Wait. No, just wait for the response now. No, but we're not listening to you now. No, wait. No, Chairman, you need to control. His focus. He asked his question now. You're listening to us now.
I think as much as I have the perseverance to listen to questions, you should equally have that perseverance to listen to my response. No, that's supposed to be called an observation. So when you say I observe, then I'll be quiet. But as I was speaking, you also came in. So you can come out with your supplement.
When the president or the minister comes out to speak, with all due respect to you, it doesn't carry the same weight as you. When this president comes out and the minister comes out, it inspires confidence in your process and in the capacity of the government to handle this matter. I mean, and we all know that we all know about how government works, and we all know about delegated responsibility in government. But what we know also is that there are certain things that you are limited in. And that's where the minister and decision makers come in. I appreciate the fact that you people are technocrats and you are here on behalf of them. But what I'm saying is, like everywhere in the world, why can't our policy makers at least be on the front foot on this?
Okay.
Yeah.
Okay, Modou will take...
Sankano, you want to add before I come in? Sankano, yeah. Sankano is part of the team, so...
Yes, it's okay. Come up.
Yeah, you can...
Okay, you want to... I can give you a chance. It seems you've been standing for so long. Don't mind, let me just migrate.
Thank you very much. Just to that question, I mean, I'm sure many people are obsessed. They want to see, okay, President Barrow on the front line. Like I said, the government, President Barrow has a policy of institutional capacity. We've been complaining that for the last 20 years, all our institutions have been rendered incompetent because everything has been personalized. So we have to understand that this government follows the due process. And right now, it has been going, the president has given a speech, and his speech is gazetted. And we cannot work in a legal vacuum. We have to follow the due process. The president is leading from behind. But what we are saying you have how progress comes. A time will come when the president will take the leadership. But right now, strengthening the institutions, and that's why he's allowing the technocrats, you know, to take the lead. That doesn't mean that his hands are off, because all of us report to him. And he said the guideline, the speech that he has given is gazetted. It's basically a matter of policy, and that's why implemented. He's talk about, for example, we are disaggregating that information, that when the people say, oh, religious gathering, naming ceremony are not part of it, I mean, it is his responsibility to explain, and that's why the Markaz is always a religious center, but it has been closed because there's an evidence. We don't want an actionism, because anything that the government does has an impact on the life of people. Just because Trump is coming up and speaking, Merkel is coming and speaking, that doesn't mean that, you know, our president should just come. He sets the agenda, and be rest assured that, you know, he is in charge. And the time will come when, you know, that, you know, when he sees the need, he will actually take the political leadership and act. For right now, the technocrats are there guiding, and he's guiding, and we report to him, and then he sets the agenda and we follow. Thank you very much.
Now, thank you. As a follow-up to what you said, and thank you for all those concerns you raised, I want to remind you that in public health emergencies, the ministers can come out and give out results of tests, for example, give an update, but the spokesperson can equally also speak on behalf of the ministers. Whatever also the minister says, he also gets approval from the president. Whatever this minister said yesterday, it was communicated to the president. He has also given his endorsement, meaning there is that political support and will. You remember also when the president traveled outside the Gambia, went to Senegal and came, what have we seen at the airport? He has demonstrated that he is willing to take part in the process. And he was the first to be screened at the airport at the foot of the aircraft. That alone is a sign of political support in giving us the courage. And in fact, all of us were courage at that time. In fact, we are now happy that the president is part of us. He accepted to be given the sanitizer, and he rubbed it on his hands, and even encourages the staff for the hard work they are doing. That alone, let me tell you, that a message alone has given courage to all the health workers in this country. And today they feel that whatever they are doing is correct. And whatever they are doing, they feel that somebody knows the work they are doing, and they are very happy with that. Whenever the statements, like look at the policy statement that was read out. This was developed by technocrats, given to the minister for endorsement. The minister also forwarded to the president because it's a policy decision the president had to say, and he said it. He came out very clearly on air. Sometimes you see statement coming from State House. Doesn't mean that every day he has to go, but you see what statement happened, especially the ban on, border closure and then banning of the airlines or the travel airspace. It's a statement from him, from the president. The idea came from a technician, and he has to endorse. And when we also had the second case, what happened? What have we seen? The technicians met and they discussed with the minister, and the minister came up with a statement. So that's how the government work. The people should not expect to see the president in all events, meaning the institutions are not mandated, they are not empowered to do what they are supposed to do. We've been empowered. From all levels, from the president's level to now, we all been given our powers and our responsibilities, and then it is left to us now to do what we are supposed to do and to implement our roles and responsibilities. I think that was a very good, and we are going to, don't expect to see it. So at some point you'll see him. Yeah. Time to time he'll just jump in and come and say one or two statements. Don't be surprised to even this press briefing one day, we can do it at State House. Don't be surprised. It can happen. We can even do it at the Minister of Health. But the Minister is busy right now, and he has delegated the responsibility to the spokesperson to speak on behalf of the ministry. And I think people have been following that trend, and we have no issues with that. Okay? Coming back to our level of preparedness, we have been prepared. There's no system, my brother, I'll quote him, there's no system in the world, especially the health system, that is perfect. That's 100% perfect. We are not a developed country, we are a developing country. We need to understand that. If China is able to have a disease, and you know that it caught China by surprise, do you know that? With all the sophisticated materials and equipment they have, this has caught them by surprise because of the festival that attracted over 40,000 people. And after that festival, they thought nothing will happen, and after 1 week, then they start having problems. China has been caught up by surprise. Our system, these cases, we were not expecting it because we felt that we are well prepared. We had a functional public emergency operations center. We had functional points of entries. We had the various structures in place. I think we have been well prepared, fully prepared. Nobody can deny what we have been. The minister was the first to go out and start sensitization at the airport. Are you not aware of that? And the airport had been strengthened. He also went to Amdallah, gave suggestions. Those suggestions and recommendations were also implemented. Are you not aware of that? The minister have also been on the air time to time talking to people. Are you not also aware of that? And I think what we are doing as a ministry, we are, for me, in my opinion, and the opinion of my colleagues, we have been well prepared. Coming down to what the worst, maybe this could be my way of talking. It's not that I'm talking, what I'm reading here, perhaps these are things that anybody have other things in your language. Perhaps I'm used to maybe or whatever, but this, whatever I'm saying here is all factual. We are going to do it. And we are also made projections. Like we don't want to tell you tomorrow we're going to have a functional laboratory here that can do a test tomorrow. That one I can say maybe. Not now, but it will happen. It will happen. We cannot, if I tell you that today, you'll quote me and say, you said that this will, journalists are very good. You make a very big headline. Mr. Jai said there'll be a functional laboratory to test coronavirus tomorrow. And it will not happen. So please, whatever I say here doesn't mean that the maybes are the one. But whatever we write here in the report, we are sure of it and we're going to implement it. Very, very well.
Thank you very much, Mr. Njai. I would want to draw the quote in here, looking at some of the other responsibilities that we are supposed to take care of. We are going to meet again tomorrow, the same time. Perhaps if there are pending issues or questions, perhaps I would want you to keep it until tomorrow. Other people will be given the opportunity. But be rest assured that there is no hearsay on the report we have read. It is information collected, validated, not once, not twice before at the time you came in the morning, you found us on a validation to ensure that we don't misinform the Gambian public. That's primarily the reason. So once again, I thank you for your perseverance and your active participation. You are a key pillar in the fight. And please, let's continue to crusade. Perhaps Mr. Modinjai would want to have a last statement.
Before I conclude, I want to thank you and your team for the sleepless nights.
Assalamu alaikum wa rahmatullah. Mbaru jiber dali hani bi kal hakilo bulan ron albe gamen tan steve la jibe kan bim frente mfundira la intara la dami ala ka fo le Ministry of Health ni ama Ministry of Health wala mu bunda dami ala talla ka mo la jar kenda jibe gambe jam antara jele bi pour kibar wa rahmatullah. Mbaru jiber dali kal hakilo bulan ron gamen tan steve al bola jibe kan bim frente mfundira na Ministry of Health wala mu dami ala talla ka jar kenda bunda jibe gambe manko kanja kibar janya nar commande pour ka ibonde kol kala me anko wolbe nyin coronavirus ni wala ba asan sanding molam me yalan ko e kadam na borna Bangladesh le atele nyin coronavirus ro gambe banko kanja bari ina tan afko ba sama ka loptano ro atenata ke modum yalan ko abanta ya fa fana ko nyim mo me yalan ko borna Bangladesh le e kada sanji taworo wulale ko bari bi ba sama ka loptano ro ameli asama loptano ro animeli be me yalan ko ma tan wala jamanto wala aninga aka kawando le ko fana animeli be nyosoroje ay wol mo le me yalan ko mo kono to wol kono yolbe sambare ke du samboda dame ka fo jele quarantine center bim frenti mfundena na wolto ka fo dame Golden Beach Hotel ni ama Golden Beach Hotel ni mudla dame ko atwa luntal kana je wala luntal ka sabati je bim frenti na wolto pour ni la managing director kacha ka me sirif bar natale pour ni sirif ni kacha soro atina ana do kulal me Golden Beach Hotel be kola ko men soro kam bar sirif men fo bolam ani man sakunda sarto le landi wala Ministry of Health jara kenda bunda amerika jibe sarto le landi pour nyin kamala atata diamuno la moy wala atata diamuno no kibara janjam bunda mole ka kumol sayenke membe ke kan Golden Beach Hotel budum am frenti nara jang Golden Beach Hotel commanding to na before nyin kabiri nyin coronavirus la fundo kake jamudal damian ko aka busy la wala mol ka siaje bakel bar bim frenti nara jang hani mo killing ita ibugaje tambi kanja wo be sabula la coronavirus la moti budum te fenkela drong ba managing director nyin atako ani molte ka chasul la no budum sam afolo ko ako nyato drong abe Ministry of Health wala ja membe marni jar kenda bunda ka be diamund la pour nyin kamala fesa silo di no la pour ani ki wala nyin nyarse diamno nyame ala kabakal nal badi malo lamil MCC
fama ke min fama hani fentuwa ja am